Welcome back. Our last guest is known as the Weight Wellness Doctor. She is dual board certified in pediatrics and obesity medicine and is the founder of a New York weight loss wellness medicine. We'll explain that when she comes on. She's with us today to speak about obesity and wellness tips that can help you shed some pounds and achieve your health goals this year and beyond. So please welcome to the show, Dr. Dina Peralta.
Hi, thank you for having me.
Welcome. How are you?
I'm good. Very excited to be here.
All right. So you have that dual thing going on.
Yeah.
Explain that just a little bit.
Well, I started like 20 years ago in my previous life as a pediatrician,
Uh huh.
and I'm board certified in pediatrics medicine. I work at Lenox Hill as the director of pediatrics for 10 years. I've been a pediatrician for a long, long time. And I am also certified in obesity medicine. I have board certifications more than 6 years ago. So, what that means is that I am a physician that is specializes in weight wellness. I like to say not
Yeah.
only weight loss, but I also work with disorder eating like anorexia, bulimia, binge eating, overweight, and obesity. So is both the spectrums of weight wellness.
Yeah. But most people come to you for what at this point, at this
So
time?
for both, my practice is solely weight wellness. I don't do general pediatrics, and I practice weight wellness for children, adolescent, and adults. And it's there's a very fine line between a disorder eating and eating disorder when we're talking about binge eating, emotional eating, and overweight and obesity. So I would say both of them, but with the new trends of GLP-1s medications in the market,
Yeah.
that they're not really new because we've been using them for like 20 years, but they're very in right now. I do have a lot of patients that come looking for, optimizing their weight and their health and using this type of medications.
Yeah. So if somebody comes to you and they can't gain weight or they don't want to eat right, you call that what?
Poor lifestyle.
And they suffer from malnutrition.
So no, if they can't gain weight or if they can't lose weight. So if they cannot gain weight and they're not eating adequate, we have to see what are the reasons, right? If the patient is malnourished, it's not necessarily, it could be based on what they're eating, but there's other stuff that could be going on hormonally, metabolically, or with their GI system.
And if a person doesn't want to eat, is that the sort of like a bulimia? What do they call it?
Anorexia most of the
Anorexia.
time. Yeah, anorexia. There's different type of anorexias: anorexia nervosa, restrictive anorexia. But this is a person that is very aware of how they want their body to look like, and
Yeah.
they basically are restricting calories to keep their weight very low.
And they both can hurt you.
Oh,
So yeah,
absolutely. Absolutely.
you're not doing the right thing. You don't have enough weight, and you're not. It's like you're malnourished, sort of, kind of.
100%.
Yeah,
100%. And it comes with so many complications in the long run.
yeah. And then if you're obese, that hurts you
Yeah.
because diabetes can everything can pop in there
All the
and be a part of
metabolic
it.
complications that will interfere and you will develop all these chronic diseases.
All sorts of degenerative diseases from
Yes.
being obese. So how do you work? How do you handle that?
So, patients that come to me with overweight and obesity, I mean, every patient is different, right? You cannot just assume that every patient has the same issue. They're either
Yeah.
eating too much, not eating the right thing, or people are not moving enough, nor they're not exercising. So, you have to see what is it that is going on independently with each patient, right? Where is their emotional health at? Is this a person that is emotionally eating, or a person that is actually trying to eat the right things, exercising, and doesn't see any results? So, first, a very thorough medical history. I do blood work in all my patients because you want to make sure that everything is balanced and that you're
Yeah.
not missing something that is significant. and then a physical exam and a body composition analysis. You want to see what's their fat percentage, what's their muscle mass, what's their visceral fat, because weight per se could be very deceiving. Sometimes you could see people that look very skinny or slim, but they're what we call skinny fat, because if I
Yeah.
do a body composition analysis, I see that their percentage of body fat is really high. Or you could see people that are very athletic, right? You could see football players that look very bulky, but they have a very high percentage of muscle mass.
Yeah.
So, it's not everything is not what we see. We have to,
Yeah.
take
Well,
it.
it seems like you know what you're talking about. That's for sure.
Oh, I like to think I do.
Yes, you do. Uh, Speak about what GLP-1 is and how it plays a role in weight loss.
GLP-1s, glucose-like peptide agonists, are medications that were designed many, many, many years ago, initially for diabetic patients. We're talking about like 20 years ago.
Yeah.
And but these patients started to have healthy weight loss that was sustainable. And then eventually these medications became FDA approved also for the management of overweight and obesity in our society. And if you ask me, it's one of the best things that have happened to the medical world, because it's a type of medication that actually helps you prevent and treat chronic diseases caused by obesity. Because by taking care
Ah,
of the overweight and the obesity, you are preventing, developing those diseases. And a lot of the times you have people that are already diagnosed with all diseases and are taking multiple medications. But when you're able to decrease the fat percentage in these patients, you're able to reverse a lot of these chronic diseases.
you can reverse heart disease,
You could reverse
diabetes.
hypertension. You could reverse high cholesterol. You could change fatty liver. A lot of things. So, and diabetes.
Yeah, yeah. Is this what Oprah Winfrey? She's on one of the drugs. Is that one of them?
Yes,
The
yes.
GLP?
Oprah Winfrey is on tirzepatide, which is what it is commercially known as Mounjaro and Zepbound. Mounjaro is FDA approved for diabetes, and Zepbound is FDA approved for overweight and obesity. But it's exactly the same medication made by the same pharmaceuticals. And we also have semaglutide, which is Ozempic, which is the one that everybody knows about from a long time ago, which is FDA approved for diabetes, and Wegovy, which is exactly the same thing made by the same pharmaceutical, Novo Nordisk, and this is FDA approved for overweight and obesity.
Yeah. Now, once you started, is there a time period where it stops, or you got to stay on it?
So these medications are designed for chronic use, because when we talk about obesity, obesity is a chronic disease, just
Ah,
like hypertension, high cholesterol, diabetes. You don't just stop taking the medication after you get like normal results, right? When you have controlled your
yeah.
hypertension, you're not going to stop taking the medication. So the same thing goes for these medications. So that said, you do need to incorporate lifestyle modifications. Um,
Yeah.
to have the best results and make it sustainable in the long run. But there's times that you're able to maintain or wean off or decrease the doses of the medications, but you do have to have very good discipline, incorporate lifestyle modifications,
Yeah.
um, what you eat. I mean, you are what you eat, and exercise.
Yeah.
So you want to be able to maintain the weight loss
Eat right,
without.
sleep right, exercise.
Yep, everything. I
Yeah.
mean, so the medication is a great tool for you to be able to modify lifestyle.
Yeah. I mean, I know a lot of people who have, you look at them, you say, wow, where did you go? Did you go to like a place where they just took good care of you? Did you go to like one of those places that you go like in Arizona and
Yeah,
you just
yeah,
get
yeah. Wellness spa, wellness
a
clinic.
wellness clinic
Yeah,
and they came back and it was like, wow, look at them. So it
yeah.
really, really works. A lot of people really like it.
I mean, I think it's one of the best things that has happened to the medical world,
Yeah.
to the science world, in the recent years because it does have the effect of changing health. And it's like the first time that we have noticed a decrease in the incidence of obesity in this country was in the last year or two. And this is mainly because of the use of GLP-1s in patients with obesity.
Yeah. So if somebody's considering it, what should they do? Should they talk to you, right, doctor?
They should definitely get a provider that knows how to manage, a provider meaning a doctor,
Uh-huh.
that knows how to manage these medications, that understands the physiology of these medications, that it's going to be able to guide you on how to prevent side effects and how to achieve the best results. When I say that, it's because a lot of the times people just either, go online, get the medication. If you're in a different
Yeah.
country, you go buy it and you
Oh, yeah.
self-medicate, and without having any body composition analysis done. And this is when you hear, or blood work, and when you hear all the terror stories, right? Like, oh my God, I felt awful. I had vomiting, I had reflux, I had nausea. The people that are experiencing most of these side effects are have not been guided correctly. And one of the other things that could happen is excessive loss of muscle, which is the opposite of what we want to achieve, because the whole point is to, with these medications and improving metabolic health, is to achieve a healthy longevity. And if you don't have a good muscle mass, you're not going to have a healthy longevity. So I would say get get a provider that is able to guide you on
Yeah.
the process, and so you have the best results possible. Do not go and get it done with somebody that is not trained,
Yeah.
that is not giving you the right recommendations, because your results are not going to be optimum.
Well, you have all the answers right there. You have all people, if they want to get involved in it, they should come and see you.
They could come and see me 100%, but there are a lot of physicians out there that are obesity board certified,
Yes.
that you could find depending where you live in your state, type of insurance, not insurance. So there is a lot out there, but I would recommend that you just don't go to a place that you're just going to be injected with something random that you have no idea where is it made, if it's FDA approved. So just make sure you know
Yeah,
who's
that's dangerous.
prescribing it and what you're putting in your body.
Yeah. Where can we go to find out more about what you're doing and what you offer us?
So, well, there's several sites you could follow me. My Instagram is Dr. Dina Peralta, and my practice is New York Weight Wellness Medicine. You could visit my website, but you could also visit Obesity Medical Association website. You could visit Obesity Society. So there is a lot of resources out there to help you.
All right. Dr. Dina Peralta, thank you so much. Founder and director, New York Weight Wellness Medicine. We appreciate you and thank you for sharing.
Thank you for having me.
All right.